Educating frontline staff is absolutely phenomenally important, because you can have all the greatest ideas in the world, but if the people on the ground floor don't understand what it is you are trying to do and don't understand the relevance of it and don't understand how it ties to the broader mission of the organization, you're just going to fail. And the one way to do it is actually to do it. I mean, you have got to have ongoing training and education programs for all frontline staff. And by the way, you have to involve them and get them to understand what the mission of the organization is when they're hired. In my organization, for example, I meet every new employee that's hired. And we have 47,000 employees. And we hire 125 people a week. And I meet every single one for about 3 hours every Monday morning, and have been doing it every Monday for 10 years. So when new people come into the organization, they get a good sense of what the organization is all about and their importance to the organization. And then you create educational programs and learning programs for all staff, and it has to be done in an interdisciplinary way. You just don't do physicians over here and nurses over there and environmental workers. You should be doing it in an interdisciplinary way as much as possible. But it requires organizations to be thinking about what's important and understand that what's important is what the frontline people do and think. That's in many ways more important than what the people up the organization think. But the two, of course, are interconnected.
All of us in academic medicine are really committed to advancing science and discovery, and we all appreciate just how important the investment of this country in scientific research is to our future. There's just no question about that, and I think that all of us feel a significant part of our role in the role of the AAMC is to ensure that the decision makers in Washington and elsewhere really understand just how important it is to invest in science. That said, I also think that it's very important for us to be accountable for the resources that we do put into research, that we have good metrics for looking at how we're investing in research, and being good stewards of that investment that this country is making into the research. As well as, I think it's important for us to take responsibility for the rising healthcare costs that are also at the other end contributing to some of the financial crisis that we're facing. So I think we have a potential to really make an impact on both sides of that equation.
How do you make innovation strategic? What we did at the University of Alabama, Birmingham, was our strategic plan is to be the preferred academic medical center for the 21st century, and that entire plan is based on being innovative. It's particularly easy for UAB to be innovative because we're such a young institution. We've always had a culture of collaboration and innovation. Some of the things we've done to make our institution more innovative is we've set up an innovation board. It's designed to make it easy for people to fail at UAB. That might sound odd. What do you mean by make it easy for people to fail? We want people to try things and not have to stake their whole career on it. So instead of coming up with a proposal and us spending $300,000 and everybody getting invested in the proposal and feeling obligated to make it work, we have a board that is funded to try small projects, $5,000, $10,000 proof of concept. If that works, then we move to a bigger funding of the project and then a bigger funding of the project. And we do about 30 or 40 of those a year. Some of them work, some of them don't. We just had a project there to come up with solve a wicket problem. And it had a $5,000 prize, and we put that out, and our nursing school won it just the other day with a program to treat diabetes in indigent patients. And the latest thing we're working on, which I'm most excited about, is an X prize. It'll be $100,000 to $200,000 prize for coming up with something truly innovative.
Managing the pace of change and encouraging the pace of change in academic medicine essentially comes from leadership at the top. It's all, in my view, about attitude. It's about understanding that the current situation just doesn't work that well, and we have to believe that there is a better way to do it. And you've got to encourage that kind of motivation by people who are in key positions in the academic medical centers. And quite frankly, my strong view is that if they don't hold the view that there is a need for change, then you got to get new people in that believe that we have to change. Because if they're not willing to challenge the status quo, you're not going to move forward. So it's all about the kinds of people you have in the positions of responsibility that have the ability to inspire other people to change.